An investment in knowledge pays the best interest. Michael Essien. Wait, what? When it comes to dating and marriages, one of the important investments you can make is in understanding your partner's health. My name is Opon Vincent Opraku, a fifth year medical student in the University for Development Studies. And I always say, before you say I do, it is important to say I know. And that's exactly why we are going to discuss the importance of this medical test to your happily ever after. So without wasting my time, anyways, we'll be starting from the least important one, working our way to the most important one. In the seventh position is common chronic medical conditions. It is important to undergo these tests due to the significant impact these conditions may have on the quality of your life. An important example is when someone gets tested and is diagnosed with diabetes or hypertension. It helps the couples make an informed decision about their future and also help them to understand the reason why their partner may have to avoid certain food and physical activities. It also helps them to know that their children are at increased risk of getting these conditions or medical conditions. And finally, it helps them to manage these conditions together because when not controlled, like diabetes, they may have to take care of them in the future. So consider a partner losing a limb because of uncontrolled diabetes. The sixth important test to perform is the fertility profile. For most people, childbirth is an important factor in their marriages. And that's why fertility profile is supposed to be done for these people. It involves series of tests and assessments that are done to determine whether couple will be able to achieve pregnancy. It is done for both men and women. Oh yeah, men can be infertile too. Knowing how fertile your partner is will help you prevent any surprises or challenges in your marriage, which may even lead to divorce or even breakups. Yeah. Let's move on. Now, the fifth medical test is the Rhesus status. So it's actually quite surprising how some people do not know their Rhesus status or their blood groups. Unaware, it may affect their decision on who to marry. The Rhesus factor is an antigen that is found on the red blood cell of some people. So if you have this antigen, you say you are Rhesus positive, and if you don't have it, you are Rhesus negative. Just like the ABO blood group system, where some blood groups are incompatible, same applies to the Rhesus 2, where Rhesus negative cannot access blood from the Rhesus positive. It will cause agglutination or clamping. When a woman who is Rhesus negative marries a man who is Rhesus positive, on their first pregnancy, the child may be Rhesus positive, and this may cause the mother to develop antibodies for the Rhesus positive blood. On the subsequent childbirth, the mother's immune system may react with the baby's blood, Rhesus positive blood, which may cause the death of the child or miscarriage. So usually, this is prevented by giving the mother Rhesus immunoglobulin, which may prevent the mother's immune system from reacting with it. But obviously, if you do not know, how are you going to fight it? And they have a certain time frame of which this drug must be given after giving birth to your first pregnancy. The fourth test you're supposed to do is sexually transmitted infections test, simply STIs, like gonorrhea, syphilis, and candidiasis. It's important to do these tests because it has a long-lasting consequences on one's health, fertility, and relationship. Knowing the status of your partner in these conditions will help you to know how to manage your relationship or your life, to determine better and important goals for yourself in curing or treating it. Finally, to our top three. The third important medical test to do is the genotype compatibility test. Isn't that supposed to be like first or something? A lot of people say genotype compatibility test or the sickle cell disease testing is usually first when determining who to marry. But I disagree. And hear me out. It's only for those who would want to give birth in their marriages that would have to do it. It's a compulsory and a must to do that to determine the probability of your child having sickle cell. Now, it will be quite surprising how people, out of ignorance and love and affection, will marry people who have the probability of giving birth to sickle cell patients. Now, I love you is important in marriage, but it's not enough. So once you are not compatible, like if you are a carrier and she's also a carrier, or if you are a carrier and a sickle cell, or both of you are sickle cell, you do not have to marry. Find a better way so that there's a better chances and a better life for your children. But if one way or the other you find yourself married, then it is advisable not to give birth. If there's an increased probability or there's a probability of giving birth to a child who may suffer from sickle cell disease. After all, adoption is always an option. Now, sickle cell comes with its own complications like severe anemia and pain, which we are going to discuss in one of our videos. So once the video is out, we will share the link in the description here for you to go and watch it. I'm not going to talk about it much because I will be famous in doing that. So without further ado, let me explain why these top two are more important than sickle. Now, to our second medical test we're supposed to do is the hepatitis B and C testing. Hepatitis B and C rank higher because they are viral infections that can cause severe liver damage, liver cancer, and even death if left untreated. It can be transferred through bodily fluids, including sexual contact, and even from mother to child during childbirth or breastfeeding. For instance, if a person has hepatitis B or C, they may not present with any symptom until there is liver damage, but will be able to transmit this infection from one person to the other, or even to their child. So knowing the hepatitis B or C status of your partner will help in timely prevention and early treatment. Now, the first important test you are supposed to do. This test doesn't even matter whether you are dating the person or even if you're going to have sex with this person, you should know this test. And it is the human immunodeficiency virus testing, HIV test for short. Why am I saying this? So just like hepatitis B and C, the human immunodeficiency virus, if left untreated, can cause certain severe conditions because it leaves the person in an immunocompromised state where fighting infections and diseases becomes difficult. If left untreated, it can lead to acquired immune deficiency syndrome (AIDS), which is a life-threatening condition. For instance, if a person has HIV, they may not be presenting with any symptom, very normal, but without medications or uncontrolled, they may be able to transmit it from themselves to their partner. Knowing this can help you to prevent acquiring this virus and timely treatment of it to prevent certain complications. And thank you for staying and watching this video. I appreciate what you're doing. Please like and subscribe and share to your friends if you find it useful. And if you think there's a test that I forgot to mention, please mention in the comment section and give me a thumbs up.